Hi everyone, thank you for joining us today as we walk through your 2018 and 2019 open enrollment options through Painters USA. My name is Nellie Mulrooney and I am the account manager from Assurance Agency that works alongside Painters USA to bring you your benefit options. Today we will be going over some of the changes that you will see with your plan options as we move into your renewal period. Medical will be moving to United Healthcare, which is a big change this year, and we will be offering 4 different plan options. So you will have the option of 2 different PPOs. The main difference between the two is the different networks that they have. And you will also have a choice of 2 different HMOs, same concept of having different networks. On the slides to follow, I will go into more depth in regards to what you can expect between all 4 of those plan options. So I will get into that a little bit more in depth here in a bit. The dental insurance will be remaining with Delta Dental and there will be no change, but we still will review that as well so that you are aware of the benefits package that you have available to you through Painters USA. First, we're going to go over the medical coverage. As I mentioned, you will have 4 plan options, and I'm going to take a little bit of time to walk through each of the 4 options that you do have. The first is the PPO AHA 6. This, up in the top here, you'll see as we walk through the presentation, there is a series of important things just to kind of note as we go. Up here is where the network is illustrated. So it's the Choice Plus network, which is the national PPO network through United Healthcare. It's their largest, most extensive network. Now, for all intents and purposes of today, we are only going to review the benefits that are in network. So we're only looking at in-network benefits, but it is important to note that on this PPO plan, you do have the option for out-of-network benefits in the event that you needed it for anything. So again, for today, we are only looking at those in-network benefits, but in the event that you ever needed out-of-network benefits, this plan does have that as an option alongside the in-network. In the benefits guide booklet that you have, some additional materials for you in regards to what out-of-network benefits are going to look like on this plan and the other PPO plan as well. If you have very specific needs in regards to out-of-network benefits, please reach out after the presentation and we're more than happy to run down any specific scenarios that you may come across in regards to out-of-network insurance needs. If you see here listed, we have some of the high-level utilization components of a medical plan illustrated on this page. Again, this is not an extensive list of all of the things that are covered on this plan, but more so the ones that are most often used. If you see under office and specialist visits, there's co-pays assigned to each of those in network. So for an office visit is a $20 copay and a specialist visit is a $40 copay, and preventive care is covered at 100%. On this plan, if you notice, there is an individual deductible of $1,000 and families $2,000, which is a decrease from what you have seen in the past. So that's an exciting component to this plan if you do have dependents that you are covering. Your out-of-pocket maximum on this plan for individual only is $4,000 and family is $8,000. So when we refer to co-insurance here on this particular level of the analysis, we are looking at that cost sharing of the plan. So after you've met that, whether it's the individual or the family deductible, then the plan itself will pay 80% after that deductible for in-network benefits, and 60% out-of-network. Again, we're not talking about out-of-network benefits in regards to the plans today for this presentation, but just note that that is the cost sharing breakdown here for this particular plan. after that deductible then is met, again, the plan for in-network would pay 80%, and you as the healthcare consumer are responsible for the other 20%. At the bottom is the prescription drug benefit that's illustrated here as retail and mail order. So something that's really important to note here is that for these particular tiered off copays, the 10, 35, 60, and the 25, 87.5, and 150, this is all set on the formulary that United Healthcare has put together, so it will be different than Blue Cross Blue Shield. So just because with Blue Cross Blue Shield you had a particular generic copay of the lowest level, that amount could fall in the 35 category, or maybe a particular drug that you or a dependent have been on is in one of those middle tiers, and it's actually now going to fall in a lower tier. So we have the capability to look up with United Healthcare to tell you the information you may need for a particular drug for you or dependents. So if you're wondering how that cost is going to look for you moving into a United Healthcare based plan, please let us know after the presentation, and we're more than happy to run that down for you and get you the answers you need so that you're able to maximize your cost as you move into this new plan year. So again, to recap here, this first plan, the AHA 6 PPO, is tied to that Choice Plus network, which is going to be your large national PPO network, United Healthcare's largest network that they have through their PPO products. Moving on, we're going to talk about the next PPO option that you have, which is the AHBX PPO. This particular PPO is tied to the core network. So the core network is a bit different than the other PPO that we just reviewed, because the core network is a bit more of a narrow PPO. So essentially you're going to have a little bit of a smaller selection compared to what you would have with the Choice Plus network through United Healthcare. If you notice here, again, we're going to take a look in depth at just these in-network benefits only. So with the office and specialist visits, again, you're looking at a $20 and a $40 copay, and preventive care is covered at 100%. The deductible on this plan for individual coverage is $1,000 and family is $2,000. And again, here we're looking at pretty great bonus if you do have dependents on your plan, especially comparatively to what used to be for your deductible. It's an exciting decrease here with this new option. Your out-of-pocket maximum for individual coverage is $4,000 and for families $8,000. As I mentioned on the prior slide, your coinsurance, which is that cost sharing that kicks in after you have met the deductible. For an in-network benefit, you're looking at the plan paying 80%. And you as the healthcare consumer responsible for the additional 20%. And out-of-network, 60% covered after you've met the out-of-network deductible amounts. Emergency room is a $250 copay and then 80%, which is that coinsurance cost sharing that's kicking in. If you look at the bottom under the prescription drug benefits, same as I mentioned on the former slide about the formulary and how particular prescription drugs are going to fall into specific categories. So again, if you have any questions in regards to this, let us know, but that breakdown is there, and that is how United Healthcare tiers off their particular prescription drugs from their formulary. So taking a look here at this particular plan, the main difference from this plan, or that this plan presents comparatively to the one that I just walked you through, is that this one has a smaller, much more narrow PPO network compared to the Choice Plus network. Your two HMO options are going to come next here in this presentation. So this is your first option, which is the AG9Y HMO. Here, if you notice, when we're talking about networks now, and it's going to change in our conversation a bit because the HMO is in-network benefits only. So there is no capability for out-of-network. HMO products are only in-network. So looking at UHC here, their Navigate network is going to be the network that this plan is associated with, and that is UHC's in-network only plan. And what's super critical here is the word only. So we only are in network with all UHC contracted providers. For office visits, it's a $20 copay. Specialist visits, it's a $40 copay. And on this plan, you do not have a deductible for individual or for family. So here, there is no deductible amount that you're going to need to meet on this plan. Your out-of-pocket maximum is for individuals, $1,500, and for family, $3,000. So goes without saying a bit that after you've met that deductible, which is you don't have one, that then the plan co-insurance, the cost sharing the plan is going to cover 100%. So you really will pay up towards that out-of-pocket maximum here that you see illustrated for the individual and the family amounts. For the emergency room, it's a $300 copay. Prescription drug benefits, same as the former slides in regards to how the formulary set, and more details in regards to that can definitely come if you have questions. But this here for in-network prescription drugs for the $10, $35, $60, and then $25, $87.5, and then $150. So the biggest takeaway here on this particular HMO is that you have UHC in network only. So you have no out-of-network capabilities, and you would need to be within UHC's contracted providers. Your next plan option is the AM24 HMO. So this HMO option is a little bit different, and it's a new offer, and we're very excited to be able to present this as an option for you as you're making your healthcare decisions. This HMO is through the Charter Network. So the Charter Network is a network made up of advocate-based hospitals and facilities only. So there is no other utilization other than advocate only. So obviously very much within the Chicagoland area. You would need to be seeing providers, hospitals, specialists, all within advocate. So if you see here, office visits are a $20 copay, specialist visits are $40 copay, preventive care 100%. Again, same as the prior HMO, no deductible here, and out-of-pocket max for individuals $1,500, families $3,000. Emergency room is $300 copay, and you're looking here again with this prescription drug benefit illustrated at the bottom of the slide, some of what that formulary is going to look like. Biggest takeaway on this HMO, while the plan design is very similar in nature to the HMO that we just reviewed on the former slide, the biggest difference here is going to be the network. So on the former slide, on that first HMO option that I walked you through, on that particular HMO, you would be required to stay within United Healthcare's contracted providers. No out of network. You have to stay within United Healthcare's network. Now on this HMO, it's even narrower in the sense that you're staying within advocate only. So that's the main difference, whether you want to have an HMO with the United Healthcare providers or you want to have an HMO with advocate providers. So that's really the main takeaway between those two HMOs as you're working through your decision here, is that this is looking at advocate network only. To take a little bit of a closer look at these particular networks and kind of how they lay out and compare with hospitals, primary care specialists, and sort of what they can offer. So and this is in the order in which I reviewed through these the slides on this presentation, the first option here is going to be this Choice Plus. This is going to be your largest national PPO network, looking at 120 hospitals, close to 10,000 primary care physicians, and then close to 12,000 specialists as well. That's going to give you, and looking through that network, that's going to give you quite a bit of breadth in your ability to go flexibility-wise where you need to. And the star is designating that the Choice Plus contains actually more than 783,000 doctors nationally, and then over 5,700 hospitals nationally. This is really looking at the Chicagoland area and taking into consideration demographic-wise the most population that would be utilizing this, but that's not an exclusive amount that's covered. So truly, looking at this note at the bottom, that's quite a bit of availability that this network has for you in the event you need it. The second network, again, the core, is going to be that narrow PPO. That's critical. So this is the second option I reviewed, and again, the plan design from the core and the Choice Plus are very similar. The biggest difference, though, is going to be the hospitals and the primary care and the amount of specialists that you'd be able to see. Looking at the Navigate, so here, this is the first of the HMO options that I, in particular, was going through with you. So this is looking at basically the amount of UHC contracted hospitals, PCPs, and specialists that you would have the ability to see within the Chicagoland area. And then again, this charter HMO, which is going to be the last one that I reviewed, is the Advocate only, okay? So this one here is going to be only within Advocate, and you can see that this number obviously is smaller since this is looking pretty exclusively at just those Advocate facilities and contracted providers within Advocate, whereas this one again is going to be with UHC. So to kind of keep your mind straight around some of the changes and understanding that, again, these first two, and please excuse my handwriting because this is very difficult to do on a mouse. These first two are the PPO options, and then this is going to be your HMO options, okay? So we've kind of got a good split here down the middle of the two that you can pick from the PPO and two from the HMO. This just gives you a bit of a higher level look to kind of understand and identify whether which option is going to be the best for you and your dependents. So I do want to take some time as well during this presentation to walk through how you would find a provider, as this is pretty critical as you're going to be moving carriers to make sure that you understand exactly what you would need to do in the event that you're looking and searching for a new provider. So if you see here reviewing this first slide, you would access the provider finder through United Healthcare's homepage. So you're going to go to www.uhc.com, and then if you notice right up here in the corner, you're going to click on Find a Doctor to go ahead and get started. So after that, you are then, you're going to be taken to a page that looks like this, and you're going to want to click on the Find a Physician, Hospital, or Health Facility, which is located under this General Directory section. So you'll see it's designated right here, and you'll click on this little link, and that will take you into the next spot. So here, under the Provider Finder, in order to go ahead and get started here on your basic healthcare needs, see who's in and who's out of network in regards to PCPs and specialists, you're going to click on this first one. If you're looking for any kind of mental health care, you would click on the right-hand side. But for today's presentation, since the majority of the focus is going to be especially for the HMO, but looking at who's in and who's out of network for some of the things that you need, specialist or PCP-wise, you're going to click on this first circle. The next option here is going to take you to this window where you can really narrow down the type of plan. So since we are going to be looking for a United Healthcare plan and not something from the state or Medicare, you're going to click on this first button here that says All United Healthcare Plans. Here, so that page is going to take you to a page that illustrates a bunch of networks, so many different networks. And it can be confusing when you're trying to figure out not only where your provider is, but then also which network you're picking. So as I mentioned on the first few slides reviewing the medical, the Choice Plus is that first one, that large national network. The Core was option 2, which is a bit more of a narrow PPO network. 3 is going to be your Navigate HMO, which is the UHC based providers only, and then 4 is the Charter HMO, which is your Advocate only HMO. So again, 1, 2, 3, and 4 coincide with the first 4 slides that I reviewed, and then also on the network comparison chart that I showed a few slides back. Those also correlate as well. So when you're on this part of the provider finder, you're going to want to make sure that you select exactly how you see it right here to find your provider for your in-network benefits. So I went ahead and typed in the zip code of where I live in Chicago, downtown, but you can type in wherever you are looking to find care near. So if you're looking close to home, if you're looking close to work, you're going to go ahead and type in that particular zip code so that you can go ahead and get started on your search. At this point in time, then you can really break down your search pretty concisely. So if you're looking to just find people and look and see what doctors, if they have a particular medical group that maybe you and your family use, any specialists that you know their name and you want to search by, you can click this first option here. If you're maybe looking for a particular hospital, or if there's a clinic, any kind of outpatient pavilion type, you're going to click on the second option here. If you're looking really pretty objectively at just trying to determine the types of services and treatments, so maybe you're not necessarily looking for a specific provider, but you're more so looking for what providers even offer specific services or treatments that you need, you would go ahead and click this third option here. If you have a particular condition or you have any kind of care that you're regularly looking to maintain and continue, and you're just wondering, again, similar to the service and treatments, what particular care is even offered for you through what condition your dependents may have, you can click here. And if you're looking to be able to estimate and figure out exactly how much something might cost with your new insurance, you can click here on the cost estimates button, and that's going to allow you to navigate a whole different part of the portal of calculating out expenses and really helping to kind of maximize that total cost for you as an employee. One main thing I really need to stress for the HMO is that if you are going to elect the HMO, either one, whether you're electing the UHC only provider HMO or you're going to elect the Advocate only in-network HMO, you have to elect a primary care physician. So if you do not elect a primary care physician, then they will not be able to enroll you through United Healthcare, and what will happen is they will have you enrolled in a very generic anyone really. They'll pinpoint you to some primary care physician, and then you will have to call and go back through the process with the customer service representative to then have that reassigned to the correct primary care physician, which isn't the worst thing, but the thing is, if you don't have the number submitted when you turn in your enrollment form, Painters USA will come back and ask you to get that information so that they can submit it, but for whatever reason, if you don't have that or you don't know what it is and we can't figure it out, you won't be enrolled timely in the HMO, and it can cause a couple weeks of delay of getting that set up. So it's very critical that you have this information. As you look through the provider finder, it's articulated on the site for you. So here's an example of kind of the number that you're going to need for the ID number. The NPI number is another that you will also need, and both are very clearly listed. If you have questions, though, as you're looking through that provider finder site, please reach out to Eric so that he can connect you to the right information so that you are comfortable when you submit your form, that you have everything that you need there, and that you know exactly who you're electing as that primary care physician for you and or dependents. Okay, so to move into dental insurance now, as I mentioned, nothing is going to be changing here for your dental coverage. So your dental PPO through Delta Dental is remaining the same. So same thing in regards to reviewing on the PowerPoint. We're really looking and focusing on the in-network options for you through Delta Dental. Again, as it states here, and as you know, if you're on this plan, out-of-network benefits are an option here, but because we do encourage you to stay in network, we're going to only review those in-network options for you here. So the PPO and Premier are the two in-network that are tied within this plan. Both have a $50 individual deductible and then a $150 family deductible. Looking at coinsurance, so dependent on which PPO network this particular services fall into, the preventive, basic, major, care are all divvied up by percentages after you've met that deductible amount. So again, same thing as the pharmacy tiers and copays on the former slides for the medical. If you have a particular procedure or service that you're wondering cost-wise, please feel free to reach out, and we're happy to help connect you in the right way to get the answers you need if for something specific to you. Orthodontia is not covered on this plan. If you see under the benefit maximum, your annual maximum, nothing's changing here. It's remaining at $1,500 for both of these in-network options. The HMO is also available for you as an option to elect as well. Very much like the medical HMO, these are in-network benefits only. So these amounts are all contracted with the particular providers and the carrier, and so therefore these scheduled fees that are illustrated here are going to be different and dependent on whatever that particular service or procedure is going to be. So there's not a whole lot necessarily to review in regards to what the amounts are that you'd be paying, but this same plan is remaining the same and is still an option for you if you'd like to elect it. So I'm going to take some time to review some next steps here and some important things to note. Your enrollment choices will remain in effect for the entire plan year through next February 31st of 2019, as long as you're an active employee. So the only way after open enrollment that you can make any changes is through a qualifying life event. So some examples would be marriage, if you were to have a child, you went through a divorce, if you had an involuntary loss of coverage, so maybe your spouse was covered, but then they lost their job and now you don't have coverage, that would qualify you to come on to Painters USA's plan. This is not an exclusive list, but it does highlight some of the more popular ways in which qualifying events come up. The biggest part of this that's important for you is that if you have any kind of life-changing event, you only have 30 days from the date of that event to notify Human Resources. So that's critical. Please don't wait. If you have a child, please say something so that they know at Painters to make sure that you are updated in the systems. If you're married, divorced, the carriers will not grant exceptions beyond that 30-day window. So it's really critical that if anything comes up throughout the course of the year that you do make that distinction to Human Resources. Enrollment forms must be turned in by Friday, February 9th. So you have about a week to make your new benefit elections and submit your form to Human Resources. If you have any questions as you're working through the process, please contact Eric. His information is located on the slide for your reference, his email, and then also phone number as well. Again, as I mentioned, Again, as I mentioned, if you have any questions or concerns, please feel free. If it's something that Eric isn't sure of, they can, at Painters, they can definitely get us in touch and we can work through any of your questions from this presentation and during your open enrollment. So thank you again so much for your time and have a great day.